أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم. All the praise and thanks are due to Allah subhanahu wa ta'ala. A salutation upon Nabi Muhammad sallallahu alayhi wa sallam, and upon all the Anbiya that Allah subhanahu wa ta'ala sent for human guidance. Today my topic is something that's not probably very rarely spoken about on the members in the Muslim world. And it relates to an event that will be commemorated on this Sunday, and it's the 24th of March. And every year this day is commemorated to mark an important point in the history of humanity. And in some ways you might consider it not directly related to Islam, but I beg to differ on that. So this 24th of March is an annual commemoration day, a day to mark an important event related to tuberculosis. So TB, as it's commonly known, I think many of us are aware of TB, have some ideas about what tuberculosis is, but I thought it's important to address this topic and how it relates to us as Muslims, but also how it relates to our responsibilities and reactions to that disease. So on this day, on the 24th of March in 1882, a specific event occurred. And just before, in the context of that occurrence was a massive decline in population numbers in Europe, in America, and probably in many other parts of the world. And 1 in 7 people in Europe and in America around that time were dying of TB. That's a massive number. 1 in 7 people, you look around the room here, 1 in 7 people were dying of TB in the 18th and 19th century of the Christian era. And this disease was called consumption at that point in time. And it sort of defined that characteristic that people saw. It almost like consumed people. And what I mean by consumed is that people would get sick and they would start wasting away. They'd become thin and die. And that's why it was called consumption. And it was a mysterious disease. People didn't know how to treat it, how to manage it. Interestingly enough, the whole idea of sunshine and TB, why people were sent to South Africa and Australia was for the sunshine, potentially to help deal with TB. But anyway, at this point in time, people were dying of TB in the thousands or tens of thousands, and nobody could understand. Almost like a jadoo. People are just dying and you couldn't explain it. And on this day, 24th of March in 1882, a German scientist used a microscope and was able to see the TB bacillus. That's the germ that causes TB. And with that discovery, he was able to prove that there was an infectious disease cause of this epidemic. And this mystery that was there for a long period of time was now understood. They could identify what it was, they could study it, understand it, and actually led to major discoveries in both prevention, in terms of vaccines, and also in terms of treatment, with millions of lives saved subsequently. So it really marks an important point in the history of infectious disease and health globally. And it's marked as an important point to recognize this important event. What's also interesting is that South Africa sits at sort of the epicenter of a lot of the TB globally. Although we have a small population compared to India and China, but for the size of our population, we have one of the highest burdens of TB in the world. And when we think of the burden of TB, and when we think of human rights that was yesterday celebrated, it's really a sadness as well that people of young productive age die. And they die of a disease that can be cured, and where a lot of research has been going into in terms of understanding how to manage and treat it. If we just look at the statistics for South Africa, in the year 2017, which is the most updated statistics that we have for South Africa, and this is just documented deaths, right, related to TB. There were 22,000 people that died of TB in the year 2017. The WHO actually estimates it close to 100,000 a year, right? But if you just take the base figure of 22,000 people, it works to about 60 people a day in the country dying of TB. It's almost like we've seen the massacre in New Zealand last week. It's almost like that every day in South Africa. And really a real sadness. And what's even more sad is that when we look at it globally, the disease seems to be strongly associated with poverty. And as Muslims, our job is to fight poverty. And when we look at the top 5 countries where they estimate to have the largest burden of TB that's undetected and untreated, and probably leading to a lot of the deaths. In the top 10 countries, 5 of them are Muslim dominated. And in the alphabetical order, it's Bangladesh, Indonesia, Nigeria, Pakistan, and Tanzania. In the top 5 of the 10 countries. And that's quite shocking if you think of this as Muslim countries that are suffering from poverty, and the net effect or evidence of brutal effect of that is really TB and deaths associated with TB. So what drives a lot of this TB? And as I indicated, there's a strong association with poverty. But that's really driven by a very basic principle of how the disease spreads. And if you look at tuberculosis, it spreads through the air, so it's not a high-risk activity that like HIV and other infectious diseases. It's really related to sharing the same space as another person. You share the same air, and therefore you transmit TB. And that really speaks to overcrowding. We see the informal settlements, etc. And that's really where a lot of transmission occurs, where people are congested in small dwellings, poor ventilation, and just fueling the epidemic. What's also amazing is that in Europe, before the discovery of antibiotics and the vaccines, etc., the TB epidemic, despite causing so many deaths, had been on a decline. Before even, and had a significant decline. And the biggest driver for that change was the socio-economic improvement in the lives of people in Europe and America. Because they lived in better accommodation, they had better nutrition, and therefore the TB epidemic was staved off. And really TB for me is a marker of poverty. If that declines, we're actually doing a better job at dealing with inequality. There are many other factors that drive it, but overcrowding is a very important component of TB transmission and the epidemic. And really where you stay influences your risk. We might be protected in our environment, but I think what's important to appreciate is that, although we think we're sort of secure from TB, we didn't have to worry about heart attacks and diabetes. But in reality, the challenge that we have, is that we're exposed to TB on a daily basis. Whether it is our workers in the office space or in our businesses, whether it is our helpers at home, whether it is going into a shopping center and being served by someone that has undetected and untreated TB. So it's really a disease that we need to sort of tackle head on. And every community is theoretically affected. What's amazing is that TB even occurs among Muslims, among Indians, and when you look at the data you see. What's even shocking is that a lot of our Muslim doctors have had TB. Sometimes even drug-resistant TB because of the work that they do. And TB is no stranger to humanity. If you look at the history of tuberculosis, it actually predates human existence. If you look at TB, as my father would always say, it's before Adam alayhi salam's time, right? So it existed from ages before, and even affects other animal species. And you ever wonder why we always drink pasteurized milk? It's because cows get TB. When you pasteurize the milk, you protect yourself. So a lot of people in Europe in the past used to get TB of the gut, and by pasteurizing milk, they actually protected themselves and therefore could consume the milk as such safely. So as I indicated, there's a huge epidemic and really sort of a measure of poverty, and also speaks to a lot around mortality and death, which unfortunately is preventable because TB is actually curable. So when we look at the whole issue of tuberculosis and really trying to understand its magnitude of effect in our country, but also globally, especially in countries that are also Muslim dominated, is to appreciate that young lives are lost. Active lives are lost. And what's very surprising, if you look at the statistics in South Africa for 2017, and you list all the causes of death, natural causes of death, the number one leading cause of death is TB, number two is diabetes, and heart attacks actually come much lower down the list. So it's really a major epidemic in the country that needs to be tackled. So when we're thinking of mortality, it reminds me of an important ayah of the Quran, where this is almost a verbatim statement from the Quran that copies previous revelation. And Allah SWT quotes this in Surah Ma'idah, verse 32. On that account, we ordained for the Bani Israel that if anyone slew or killed a person, unless it be for murder or for spreading mischief in the land, it would be as if he slew the whole people. And if anyone saved a life, it would be as if he saved the life of a whole people. So this one here really speaks a lot about our role as Muslims in protecting life. Whether it is, and I think there's multiple ways we could do this. There's one in terms of basic education and knowledge, and the second is sort of an active role in being able to provide funding and also necessary skills in tackling this epidemic. I think the first around basic knowledge. Not many people really appreciate the symptoms of TB. The biggest problem is that it presents like the common cold or flu. Usually starts off with a cough, sometimes fever, night sweats, common things that people might feel in summer, for example, or in winter during the cough season. But it's a condition that basically progressively gets worse, and if there's no response, and not self-resolving, then it really is an important indication that TB needs to be investigated. What's very positive in this country about TB is that this country has taken a strong drive towards dealing with the epidemic, but I think not enough is still being done. If you had to have TB anywhere in the world, you're probably best off being in South Africa, because the best diagnostics for TB and the best treatments are actually available in South Africa and actually made free by the South African government. So in that sense, it's important value addition in what's being done. But we still have the highest mortality for TB, and it continues to spread. I think, there's a lot of stigma that comes out with TB as well, whether it is within other communities, but also within our own communities. I actually have a doctor friend that told me that she's afraid to tell her family that she had TB and she's cured, because of how she'd be treated, having known that fact. I mean, we also know that sometimes your staff member comes to the letter and says he's got TB and he's coming back to work and it's a panic, It actually drives a lot of that fear, and it's unnecessary fear. And I think just to illustrate and elaborate on that. So the biggest problem with TB and its risk to people is transmission. And the only effective way of stopping transmission is through treatment, early effective treatment. And there was a study done at Witbank where they actually looked at drug-resistant TB. And that's usually when we don't have as effective drugs as the first-line therapies. And if a person was put on to effective drug-resistant TB treatment, within 48 hours he was 90% less infectious. So your risk diminishes almost completely. So it's critical that, when we have people that are coughing for long, get them to get investigated. Earlier they get treated, the better it is for everyone. And we're actually saving potential future infections and lives as such. The second is also the fear around TB. So, you think that, it's transmissible and it's infectious, but not everyone that gets infected gets disease. And just to give you an indication, globally, of the 7 billion walking this planet, 1 in 3 people had a TB infection. Even in this audience, it's probably 1 in 3 of us already have the TB organism in our body. And it causes no harm to us, and we actually could self-cure ourselves and die naturally. Okay? And what's important to appreciate that is that your lifetime risk is about 1 in 10% to get TB at the end of life. However, if your immune system is diminished in any way, and HIV has been a biggest driver in South Africa, but whether it's malnutrition, HIV, being on chemotherapeutic agents for cancer, your risk obviously increases, and therefore the suspicion for developing disease is far greater. The second thing is they did a study looking at the risk for people that were exposed to TB at home. And what is the risk around that? And obviously these are contained environments where you're constantly exposed to someone. There's only a 3% risk of getting active disease in the first year. So the risk is fairly low. So there isn't that much of panic. But importantly, if you get tested and treated early, it's curable. And it takes 6 months of treatment, which is not that convenient. But fundamentally, a lot of people have taken the medication and cured, and we have hundreds of thousands cured every year with TB. The other important thing as well is that if you've been exposed either at work or in the home space with TB, you need to be investigated because there is preventative therapy. So to prevent you from going to active disease, initially that was about 6 months of treatment, and there have been new studies to show just 1 month of treatment could protect you from TB. So there's a lot of misinformation around TB, and I'm hoping that we realize that it's an epidemic that occurs throughout this country, and it's a constant epidemic. We're constantly exposed. I think also educating your staff, etc., around TB. There's lots of information on the internet as well. Encourage people to get tested for TB and sometimes HIV where it's relevant as well. So just the last thing around the issue of stigma. It's a really big issue. As I indicated, there's a Muslim doctor, a friend of mine, but I know many others as well, but they're very afraid to tell their family and friends that they've had TB. And that really causes a major problem because people don't come forward to get tested and treated, and that delay means that you infect additional people. And one person can, on average, infect about 5 to 8 people from a single infection, so we really need to contain them. And there might be another ayah as well. We often think of it more in a sense about how we deal with one another in a daily communication sense. But it has an important measure around how we relate to one another. And it's in Surah 49 where Allah subhanahu says, "O you believe, let not some of you laugh at others. It may be that the latter are better than the former, nor be sarcastic or offensive to others." And I think when we're looking at those things here, we need to also realize that when it comes to diseases, we need to show empathy. So if your staff member has been diagnosed with TB, it's important that you show empathy towards that person. He's had a tough time. He's come from a poverty situation. He's got TB because of the environment in which he lives, and really making it more difficult by trying to fire the guy. And the reality is that if you provide them effective treatment, cure them, and provide the support, that's the Muslim behavior. So the last two messages I'd like to leave you with today is that TB is an important disease. We have great tools to actually sort out the problem. We need to be more active in terms of our understanding of the disease and being responsive to it. And that leads to two important things. The responsibility to save lives is a Muslim responsibility. So whether it is through the skills we have, knowledge we have, or even the funding that we have, to direct efforts at dealing with the problem. The second is the issue around empathy, around dealing with people that have TB. As I said, South Africa is an epicenter of TB, and really it's critical that we as Muslims play an important active role. And just the last pointing word is that what is fascinating from all the years that they have this World TB Day, they've actually made an effort this year to engage all religious communities to communicate this message. So they're going to churches, they're going to synagogues, African traditional churches as well, to try and get the message out that people need to come forward, test, and get better educated about TB as such. And we can really make a difference both in South Africa and hopefully also deal with the scourging epidemics in Muslim countries where TB is actually very common. Jazakallah khair. Assalamu alaikum wa rahmatullahi wa barakatuh.